about a year into that, Seattle had its very first case of AIDS formally diagnosed, and the media began to pick up on it, and many of us were interviewed at the Seattle Gay Clinic about what we were seeing, and this advisory group that Dr. Hunter Hansfield had formed, we met monthly at the STD clinic, and the public health department was realizing they were getting calls from very worried people. They didn't really have the resources to handle all of the calls. We didn't have the resources at the Seattle Gay Clinic to handle that. So we, in one of those meetings, one of the nurses suggested, well, what if we set up an AIDS hotline? I'll bet we can get a telephone here at the public health department and a desk or something ready, or rather, if we could only get somebody to handle the calls. And one of our volunteers at the Seattle Gay Clinic, Will Jones, who had volunteered to be a facilitator for a hepatitis support group, because hepatitis was another thing that we saw quite often at the Gay Clinic, although we couldn't treat it, but we tried to offer support to gay men who had hepatitis. He was out of a job and looking for something to do, and he had enough knowledge about what was happening with AIDS, as well as any of us at that point, that he said he'd be willing to volunteer for the hotline. So they set up a hotline, and immediately it was busy, even without very much publicity about it. I'm leaving out lots of things, but here we're talking 1982, 1983, where a few more cases were diagnosed in Seattle, many cases in New York and San Francisco.